If you realize that nursing homes are not exactly the place that you have imagined, or if it is much worse than what you have imagined, how would that affect your retirement planning? Nursing homes, which are also called the long-term care homes in Canada, are a place where older people who are also frail live together. So as a result, it is a living condition that can be very vulnerable to any contagious diseases. And in the last COVID-19 pandemic, we have all witnessed that, nursing homes can be very vulnerable to any potential pandemic. In the first 1.5 years since the beginning of the pandemic, there have been more than 14,000 deaths occurred in nursing homes in Canada. And the tragedy happened in nursing homes was not limited to the direct deaths due to COVID-19 itself. Many nurses and staff have left the nursing homes due to the fear of catching COVID. And as a result, many residents were poorly taken care of, and oftentimes they were not fed or hydrated properly. With extensive media coverage of what happened during the pandemic in Canadian nursing homes, we can anticipate that many Canadians are now less willing to enter a nursing home. And even though the COVID-19 pandemic itself is a history now, people have learned that nursing homes are an environment that is vulnerable to any future pandemic. But there was no large-scale evidence about these potential changes in the preferences. So with my colleagues, I fielded a survey in Ontario and Quebec. The survey was fielded at the end of 2020, and it was fielded to those who were in their 50s and 60s. So the survey was not about what they are currently doing with their long-term care. It was more about what they plan to do with their long-term care, when they need it in 10 or 20 years. And we have learned that the vast majority of the respondents, about 72%, said they were much less willing to enter a nursing home after seeing what happened in nursing homes during the pandemic. And you might think this is just a one-time thing because the survey was done in the middle of the pandemic. But in another survey we implemented in 2023, we basically found the same responses to the same question. So when people are less willing to enter a nursing home, they should look for alternatives. And one common alternative is to receive the long-term care in their own home, which is called in-home care. But the thing is that in Canada, in-home care is much costlier than entering a nursing home. This is mainly because the government subsidies are much more generous to the nursing home care, while it is limited to using in-home care. If Canadians want to use in-home care instead of nursing home care, they have to prepare more savings for their late in life. Then the question is, are Canadians planning to do that? According to our survey, about a quarter of the respondents said they are planning to save more because they want to use the costlier option that is in-home care. But recognizing the need for saving more does not necessarily mean that people are actually saving more or they are planning to save more, because if their current budget is tight, even if they realize that they have to save more, there is nothing much they can do about that. And this may explain why 70% of our respondents do not plan to change their savings, even though they recognize the need for more savings. So all the responses that I have described so far basically point to that, many Canadians can benefit from increased subsidies to using in-home care. But then the questions are how to finance those subsidies and what is the right way to provide those subsidies. For example, do we need to give tax credit to the family caregivers, or do we need to give direct subsidies to those who use paid in-home care? And also, what will be the impact of these subsidies on the long-term care market? These are all very important questions, but are also very complex questions. And answering to these questions will require further research. But what we can see from our survey responses is that at least there is a strong support for those policies. About 70% of our respondents said they support giving more subsidies to using in-home care, even though that means higher taxes in the future. So this means that giving more subsidies to in-home care is at least a politically feasible option. So for the younger generations, what you can do is to be aware of all these financial needs in late life and try to save as early as possible. Okay, if you have the same amount of the target retirement savings, if you start saving earlier on in your life, it's going to be much easier to reach that target amount of saving. Of course, I understand that the younger generations in Canada are facing many economic challenges in terms of finding jobs and etc. But as soon as your career starts, you have enough money to save. You have to be aware of all these financial needs you have in late life. Another thing I want to mention is that this landscape about long-term care is changing very quickly over time with the aging population as well as the changes in the technologies that are used in nursing homes as well as in home care. One of my recent research started looking at the technologies used at nursing homes, which involve care robots. And these care robots do many things. And as a young generation, maybe you want to pay attention to, how the care is supplied to the older generation and how that is changing over time. Maybe that's important for your personal life as well, but also if you are interested in this topic, that can be an important future research agenda.